Ever pondered why the bladder, an organ that's often overlooked, can become a ground zero for a disease as daunting as cancer? Welcome to a journey of understanding bladder cancer. Bladder cancer, a term that might sound foreign to many, is a malignancy that originates in the urinary bladder. The bladder, a balloon-shaped organ that stores urine, can sometimes fall prey to rogue cells that multiply uncontrollably, forming a mass known as a tumor. When this tumor is malignant, it's known as bladder cancer. Before the advent of modern medicine, bladder cancer was an adversary that often seemed invincible. Historically, treatments were rudimentary and involved the use of herbs and natural remedies. During the Middle Ages, brave surgeons attempted to physically remove tumors. However, with no knowledge of anesthesia or understanding of microbial infection, these procedures were fraught with peril and often resulted in more harm than good. Fast forward to the 19th and early 20th centuries, early forms of chemotherapy and radiation began to emerge. Yet these treatments were in their infancy and often induced side effects as devastating as the disease itself. Today we breathe a sigh of relief, for treatments have come a long way since then. So, what causes bladder cancer, you might ask? While the exact cause remains shrouded in the realm of scientific research, certain risk factors have been identified. Smoking, for instance, is a leading culprit. It's believed that harmful chemicals from cigarette smoke pass through the bloodstream and end up in the urine, damaging the lining of the bladder. Other risk factors include chronic bladder inflammation, certain genetic mutations, and exposure to specific chemicals in the workplace. Now, onto the symptoms. Blood in the urine, often painless, is the most common symptom, turning the urine rust-colored or bright red. Other symptoms include frequent urination, a burning sensation when urinating, and lower back pain. However, these symptoms are not exclusive to bladder cancer and can be caused by other conditions too. Hence, if you experience any of these symptoms, it's crucial to consult a healthcare professional for an accurate diagnosis. When it comes to treatment, the options are as diverse as the stages and types of bladder cancer. Surgery is often the first line of defense, aiming to remove as much of the cancer as possible. Other treatments include immunotherapy, which boosts the body's immune system to fight the cancer, and chemotherapy, which uses drugs to kill cancer cells. Radiation therapy, which uses high-energy beams to destroy cancer cells, is another option. The choice of treatment largely depends on the stage and type of cancer, as well as the patient's overall health. Now, to sum it up for you, bladder cancer is a type of malignancy that originates in the urinary bladder. Risk factors include smoking, chronic bladder inflammation, certain genetic mutations, and chemical exposure. Symptoms often involve changes in urination and can include blood in the urine. As for treatment, options range from surgery to immunotherapy, chemotherapy, and radiation therapy. Remember, knowledge is power. The more we understand about diseases like bladder cancer, the better equipped we are to prevent, detect early, and treat them effectively. So keep learning, keep growing, and keep shining. Until next time, take care of yourself and those around you.